All right, 7:18 now. With advances in technology happening pretty much every single day, the chance of women surviving breast cancer are getting better and better. Now, a new device called a BioZorb is helping with radiation treatment, and it's all being done right here in Albuquerque. News 13's David Romero caught up with a doctor and a patient who have already used this new medical wonder.
It's the worst news any woman can hear. A lump in her breast being diagnosed as cancerous.
Well, you're scared. It's like when it was first discovered, there's fear. You feel like you were kicked in the gut.
And that's what happened to Anna Bachicha Reynolds, but the fear didn't end there. The next concern was the inevitable pain to come with radiation treatment once the lump was removed. That's where breast cancer surgeon Dr. Linda Ann Smith recommended using a new device called a BioZorb in the procedure, which would work in more ways than one.
The device we implant in surgery looks like this, and it is secured right at the side of the tumor, and it helps to create a target that radiation doctors can hit no matter what.
In providing radiation oncologists a more accurate site to administer high-dose radiation, it's cutting down on the widespread damaging effects given off by the treatment.
The radiation damage goes on for 10 years. It's not anything we can undo. And if we can avoid giving that very high-dose radiation to normal tissue, the patient is going to do better. There'll be less pain, less scarring. Cosmetic outcomes should be much better than what we've ever had before.
It's also making less suffering for patients like Anna.
When it was over 5 days, and I think, oh my God, this compared to versus 6 weeks of radiation therapy, this is wonderful.
In addition to being a guide for directing the radiation, it's also proving to help cosmetically for patients who have had lumps removed.
The steps that I see that are important is it gives us a little coil in there, like a little beehive, that supports the tissue so that it heals better. So rather than collapsing in like the Grand Canyon, it actually gives us a nice smooth contour to where we can rebuild the breast tissue around it. That's called oncoplastic surgery. We want these ladies to look better after their surgery than before.
From what I have been told by the doctor, by the oncologist, I have a 94% probability of no recurrence. So I'm confident that I do have a good life ahead of me.
David Romero, KRQE This Morning.
All right, Lovelace Women's Hospital is the first hospital in the region to offer the BioZorb device in breast cancer treatments. Once it's in place in the patient, they go anywhere else in the state or country, and radiation oncologists will know where to direct that radiation.